I covered a lot of other things in the vector-borne thing. There are certainly other tick-related diseases, like most of them are summertime because ticks are warm weather, and have a sort of a flu-like presentation with the understanding that there is no flu in the summertime, so we shouldn't be making that diagnosis, at least not in this part of the world. So things like Babesia, Ehrlichia, Anaplasma, and most importantly, Rocky Mountain spotted fever, because that disease has a 25% mortality, and the mortality is directly related to delays in treatment. So it's one of those diseases that we have to have a very low threshold for considering and starting treatment before we've proven the diagnosis, or people will die, and they do. It's not just or, they will. People die of Rocky Mountain spotted fever every year in this country, and partially because of a delay in diagnosis. Actually, the name Rocky Mountain spotted fever is a misnomer. It was originally described in Bitterroot Valley in Montana, in southwest Montana. But most of the cases these days are not. In fact, most of the cases are in the mid-Atlantic states, Virginia, North Carolina, but also a pocket in Oklahoma. The onset looks like flu in the summertime. Headaches, and I don't mean stuffed head, runny nose. That's not really flu. I'm talking about high fevers, bad headaches, bad muscle aches, being quite toxemic. There is a rash associated with it, which I think most healthcare providers know, but unfortunately the rash is only present in 10 to 15% when people initially get sick, and it doesn't usually appear until about day 4, 5. So you have to sort of consider and make the diagnosis before it's obvious, or people will die. It's a scary thing. It's scary for me, and I'm aware of it because I'm afraid of missing the diagnosis. So I think the threshold for treating empirically, which is a little unusual for infectious disease doctors to suggest using antibiotics in a non-definitive setting. But this is a situation where, you know, if it's the time of year, if there's been potential tick exposure with a syndrome that I described of myalgias, headaches, fevers, where I would use doxy with a very low threshold.